Great.
Yeah.
Hi, everybody. Yeah, we're here thanks to the Gay Men Sexual Health Alliance, and thanks to all of you guys. We're here to talk about sex, drugs, and COVID-19. This is a conversation that is a short time in coming, but I think is actually something that people are kind of chomping at the bit for. So I'm pretty stoked that we were able to get a good group of folks at this table or virtual table to talk about it. So we're going to be talking about a lot of different things about sex, about drugs, about kind of confinement and the way that gay, bi, queer, and other men have sex with men. And we'll just be talking about queer men and gay men as like umbrella terms. But the ways that we kind of connect with each other and respond to this time of the COVID-19 pandemic. Again, I just want to make it clear to folks that we're not giving out medical or legal advice. Not doing that here. So if you want to get more medical information or any kind of information about COVID-19, please contact your local health authority. They will be the ones best situated to give you the information that's actually appropriate for the place that you are in the world. And again, maybe we could just introduce ourselves. So I'm Makiki, and I'm really excited to be here. Jonathan, we didn't hear you. Try it again. Jonathan, can't hear you still.
Oh, well, you said my name twice. I'm Jonathan. I have multiple audio streams going because, she's very versatile. And so I am also delighted to be here.
I am Eric, and I'm super excited to be part of this conversation.
I'm Ali. Hi.
I'm Caleb. Happy to be here.
Hi, my name is Oran Strawn, and I'm happy to be a part of this conversation because I think it's important. And also, I'm going to have fun with it. So I know half of y'all, or most of y'all, so it's going to be chill.
Right.
So thanks you all for being here. Like, I adore you all, and I'm really stoked that we are getting to have this jam with us particular folks. And then for those at home, there is going to be an opportunity to ask some questions in the live feed. And also some of those resources that we mentioned are going to be dropped in links. It depends what format you're looking at, but in links that are either attached to this video or on the GMSH social media accounts. So if we mention something and you're like, well, I would love to know how to find that, we're going to do our best to populate the text addendum with all of that. And I should just give the heads up that we are going to be talking about drugs and sex. And so know that coming into it. Hopefully that excites you as much as it excites me. We're also going to be talking about this fucking COVID shit. So also we can curse, right? I'm going to do it. So I think we kind of wanted to just start off with that like COVID 101 and just crowdsource like what we know about it. So like the first thing is like, what is it and how is it spread?
From what we know, COVID-19 is a respiratory infection that can have some pretty serious consequences. And one of the things that we're seeing is that kind of not dissimilar to what we who like come from the HIV response is that, like a lot of people may have this infection but not actually know it. So we're seeing that that people are able to transmit COVID-19 and people are able to acquire it and not recognize that they have acquired this infection and then therefore pass it on without knowing. So one of the things that we're seeing with this is that it's actually like a lot more virulent or a lot more contagious. It's a stronger virus than a lot of others that we've seen, like than the flu or whatever. So we see that it's transmitted mostly through respiratory droplets. So that's like, it's, it's like spit, and when we sneeze and whatever, that's why they do encourage the sneeze into your elbow. But also like that a secondary, touching it on surfaces, but it can live on surfaces for like a significant period of time. That's one of the other kind of considerations for keeping people inside and keeping people isolated and and kind of our self-imposed quarantines is because like if I go outside and I have COVID-19 and I cough, on like the fruit at the supermarket, and then someone goes and like picks up the fruit and then like rubs their face or their nose, and it has an entry point into the mucous membranes. So essentially we're seeing that this is like, it has a longer incubation period, so people are not necessarily going to not going to see symptoms before there's a possibility that they could have actually passed it on. Jonathan, do you want to add anything on that?
Well, I think like it's important to know that a lot of people won't experience symptoms, but there are symptoms. Like dry cough, fever. They recently added into that list losing your sense of taste and smell, as well as difficulty breathing, shortness of breath. So if you are experiencing those symptoms, it's best to be hardcore about the quarantine thing and stay home and like stay as far from the fruit and the coughing on the fruit as possible. But also they may be mild or moderate symptoms, especially if you're kind of younger folks like us. And then those symptoms can get really intense and grow to pneumonia and worse, including death for folks who are more vulnerable to the virus. So like many viruses, it's most infectious like right when you first get it, when you may not even be feeling that. But especially if you are feeling symptoms, you can call like Telehealth Ontario or somewhere to talk through it. But just quarantine is sort of the advice we're getting. And I think like HIV and any other virus, the only way to know if you have it for sure is to get a test. But right now they're prioritizing tests in Ontario for healthcare providers. That said, you can call your nearest assessment center or the Telehealth Ontario and find out more about whether you ought to be tested or whether you can access that or not. So it's spread so easily and so invisibly that's where that stay at home and stay away from others kind of thing comes from, and everyone's calling it social distancing, though I think that's like just like a weird way to phrase it because I've never spent so much time talking to people I know. But I guess I want to ask like you guys what your experience of social distancing is or isn't, like what you
I've been in the house for like weeks and weeks, and then like you come to a point where you're like, I can't take it anymore. What do I do? And again, that idleness and horniness, which we're going to get into later. I don't want to open up too much of a can of worms, but for me, it's just like playing video games, and you only could cling for so long, and also just getting into things that maybe hobbies or interests that you probably put on the back burner. Like for instance, I write poetry. I like to draw. I'm a fashion student, so I like to make some sketches. So that's how I'm kind of approaching it now. But when it comes to the hooking up, I guess we'll open that can of worms. But yeah, it's been really hard for me, man. Like I'm a person not used to staying at home like all the time. Either I'm working or the weather's nice outside. I want to go to the park, and I'm like, whoa, like a little puppy, like I want to go outside. But it is what it is. This is our reality.
I think it's really important to note that social distancing doesn't necessarily mean complete isolation. So there is a safety, like an amount of safe space that you can put between yourself and other people to still do things. I know that I've been receiving a lot of like messages from friends saying, I'm running out of groceries. What do I do? And the correct answer to that is go get groceries. Like you can still go out into the community and do the things that you need to do to survive. Just do it a little bit smarter than you would normally do.
I just wanted to just quick say, I think that there are a lot of people who are feeling way paranoid about this. And then there are other people who are feeling a little bit more relaxed about it. First, we should just shout out to gay men, especially a lot of gay men from other generations who lived through an epidemic before and have taught at least me, and I think a lot of us, a lot about what living in a scary fucking time is like. And so we can move into a little bit about the hooking up and hanging out stuff, but I would be remiss if we didn't talk about washing your hands. Everyone loves that's like, there's some amazing TikToks about it, you know. I haven't seen them, but I heard. Kopi Mizrahi released a little wash your hands Vogue video. But that's sort of like the best way, because it does live on surfaces and all of that. Washing your hands, if you don't have access to washing your hands, like because of where you live or where you're at, in most cities, they open hand washing stations in different places. And of course, hand sanitizer is a little bit hard to get. But I've been walking around with my little bottle and refilling it at the public hand sanitizer places. So that's what I've been doing, but like keeping those hands clean. And I think I've touched my face like 6 times during this call, but you're not really supposed to do that either. Just keep your hands away from your beautiful mug.
I am a 100% touch the skin honey kind of queen, so there's like no hope for me to stop touching my face. That is just my reality. So it's like, so I always have like, anytime I see a bar of soap, I'm just diving into it, because it is like the soap actually, you know, like helps to kill that that virus. So yeah, washing your hands is really one of the most significant. Washing your hands and keeping distance. Those are the 2 ways that we know kind of prevent the spread of it.
Do you want to talk about sex? Because I feel like that's the thing we not like. The social distancing thing is like really easy to practice in some regards, or less easy in some regards. And then it's like every single gay dude I'm talking to is like, I'm so fucking horny, I'm gonna hook up, or can I hook up, or maybe I shouldn't hook up. So I don't know, Kiki, if you wanted to open up some of the I don't know where we even start.
I think that this is actually like a really important conversation for us to have in a bit of a more nuanced way, because I mean, yeah, like the official answer is if you are experiencing symptoms, no. If you are not experiencing symptoms and have a live-in sex partner, then go for it. And it's actually encouraged that might be a way to help you kind of like manage some of the anxiety of, you know, like of dealing with living in isolation or quarantine. But if you don't, and for a lot of queer folks, like and queer guys, a lot of us don't live with our significant others, or like don't have significant others, don't have a sex partner that's under our roof, you know? And so then what? Like, it's just, the assumption is that then there's no sex, and also no real like end of the timeline that we're working with, you know? Like, people had been talking about like, oh, a 2-week quarantine or 2 weeks, you know, self-isolation. But now we're like, that was to see if one develops symptoms on their own. But now we're seeing that this timeline is actually extending like down the road and down the road. So what does that mean? You know, like, what does that mean for, especially for a community of guys that have been told that we care too much about pleasure, when in fact intimacy is a thing that now anybody who's married gets to have and not even question or not even think about. But for a lot of folks in our community, this thing that's actually like a totally, you know, inherent basic part of human existence is like connection and community and physicality. And now we're being told that that we're not allowed to access it. And there's lots of ways that we can not do that. But I think one of the things that we're going to talk about today is also about like, okay, so maybe I can't hold out. What are some ways that, instead of throwing the baby out with the bathwater, what are some harm reduction tips and tricks or strategies that I can try and like roll into my experience so that I'm lessening the likelihood of contracting it and lessening the likelihood of passing it on. But before that, it's like, if the goal is no contact, if the goal is to kind of, you know, stay in your room, you know, then what are some things that folks have been doing?
The one thing that I'm always kind of telling people to do is, if you're at home and you're using drugs on your own, which is something that a lot of people might be doing because of COVID-19, it's really important to really think about these harm reduction techniques and really be concerned for your own safety. So doing things like letting another person know that you're using drugs, checking in with an individual on a regular basis so that they know that you're okay. Something as simple as leaving the door unlocked so that if you do need to call an ambulance, they're not locked out and they can get in to help you out. if you can use drugs with someone virtually, that's really the best thing to do, because then the person can see you in real time and see how you're doing. And if you're not doing so well, they can send help to you if that needs to happen. So I think it's really important that you don't just, turn off just sit in your living room or your bedroom and use drugs on your own without communicating with the outside world that you're doing that so that you can remain safe.
I think that's first of all amazing information and important, and I think we're gonna talk also like specifically about drug stuff as well, and a little down the line. But I'm also thinking about hooking up for guys who don't party, like.
I think the conversation we're having is about deviance, right? Like, what does it mean to be a deviant and to deviate from normative sex, like in a marriage household, and be that person? And like right now, deviance is kind of like not like, for lack of a better word, not okay always. And how do you get the kind of pleasure you want and also keep the people you're having pleasure with safe? And that's like a hard question, because you have to assess what is this safe enough? Is this risky? Is this worth it to be risky? Like those are questions we have to start asking ourselves, and they're not simple and they're complicated. And I think it has to be by situation and centering a person's autonomy first, right? I think you mentioned that in the beginning, that we are going to center in the conversation people's autonomy. I think we have to that's what we have to do when we're having sex, is like give people as much information as possible about what's going on with us and the environment around them, and then roll with that.
Charles, we have to be really real, because at the end of the day, the girls don't care. When I say the girls, I'm talking about the guys who are on Grindr and stuff like that, because we're talking about people, or we're talking about our community that's already been isolated for different reasons. Again, I can speak on my experience being, being Black and queer and all those intersectionalities. But the reality is, people are bored, they're idle, you get horny, they want to fuck. Realistically, I think the only thing that you can really do is if you have a consistent, again, sex partner, like a boyfriend or whatever, that's the best way to go around it. Because you meet somebody who you never met before, especially with what's happening now. You don't know where those people have been. You don't know how well they're practicing, like, COVID-19 best practices or whatever. You don't know. You don't know these people. But you know what? Again, you always take a chance when you meet somebody new. So I don't think it's logical to say, like, what you're going to do when you're going to meet somebody new. You should not. And if you're going to, you keep that one person or have that agreement that you're going to, hey, look, with everything that's happening right now, I'd rather just kind of, like, deal with you. You understand what I'm saying?
I think it's just, I'm listening to all this, I think it's just important to be honest, really, to be honest with your partners, be honest with your friends and yourself, about what your goals are, what you're okay with, and how you're going to proceed. Yeah.
I do want to speak up and say something that as I'm listening to this conversation and I'm listening to what folks have to say, I completely respect all of your opinions and I see exactly where you're coming from. But as you're talking about like hooking up in person and things like that, the thought that happens in my mind is I keep seeing that map on the Government of Canada's website of the numbers just going up and up and up and up. And the question that keeps coming up in my head is, what responsibility do we have to break that cycle of this virus getting to, like, we had 260 new cases in Ontario in one day. So I'm not trying to say that you're all wrong. That's absolutely not what I'm saying. I'm saying in the context of this pandemic and this virus going bigger and bigger and bigger, where do we put that? Okay, I'm horny and I want to have sex, which that's fine. I'm okay with that. But also there's a need to protect the greater good of like everyone around us, right? So where is that line drawn? That's my question I have for the people that are having this discussion.
Ali, do you want to chime in?
Yeah, no, I think that, like, our responsibility to a community is incredibly important. Like, we have a duty to the people around us to try and be good. Yes, but like, this isn't about good or bad, right? It's like, the thing is a lot of people live in, like, a lot of people live in a reality where they're not thinking about tomorrow, right? They don't have time to think about tomorrow. And a lot of people are thinking about tomorrow, and what's sexy to them is risk. There's different experiences happening all around us, and we just deal with the reality that people are gonna fuck. They're going to have sex. They're going to meet each other. We're social creatures is what we do. We've done it from the beginning of time. So then what we do is we have to have that honest conversation about like when I hook up with, or when I do whatever I'm going to do, what can I do to make sure that I'm keeping everyone safe? Right. And that depends on the moment and the space that you're like existing in at that time. And like what I've been seeing is a response to that reality being true is people shaming people for the realities. And we know that doesn't work, right? We know that shaming people just further marginalizes them and further puts them into like the scum of the earth sort of corner where we should put everybody. So I don't want to do that.
I want to maybe just take a second to explain, especially for anyone at home, like at least what I see and what I think we've talked about a bit at GMSH as being sort of like, there's a bit of a hierarchy, not hierarchy, I hate hierarchies, fuck hierarchies. There are a couple of different options that people are looking at, right? So if you're hooking up, Kiki mentioned, your partner that you already live with and are sharing halogerms with is somebody who you may already be having contact with and probably having a lot of conversations with. So that's something that maybe in terms of the likelihood of exposure, contact, and spread is lower than like me getting bred by 16 guys who come in my door who I just like met on Craigslist, you know what I mean? As fun as that sounds. And so I think we were kind of talking about it as like, well, you can pick none, which means sort of autoerotics of masturbation, cam, all that, which I think I would love to get some tips on because that the cam shit is kind of new to me, trying to monetize all this. And then pick one, so pick none, and then pick one is maybe your partner, your person, whatever, or maybe pick just some. And like, in a way, pick just some is gonna mean there's more contact and less knowledge and information, because as much as we're trying to share information, we're also thinking of these things in different terms. So I say, hey, have you been quarantining? Yeah, girl, definitely I've been quarantining, but what does that mean to you? And does that mean that you don't have COVID? Does that mean that why should I feel safer about that? I don't know, maybe I do, maybe I don't. I have a relationship with you. And then a week later, we've all been quarantining for another week, but this thing, I went to the grocery store, I had to cut, you know? So I feel like then the more people there are, the less we like possibly can know, and the more we're gonna want to communicate as best we can, you know?
What I want to share is honestly, like, it's not a point of judgment, but you have to look at it like sex and drugs don't only involve persons who are hooking up. You have the dealers who are going to be moving around and shifting or going to spot to spot. How are they handling this? Being realistic, and actually, we have to sacrifice something. There's a lot of things that I do not do now because of the situation. Like, of course, I'm not going to work, and I just shared earlier, like, I'm a person who likes to go places, but like, I'm limiting my social interaction with certain people. There's no way you can tell, you know, who has what, right? You could go to the corner store, right? But anyway, to keep it in the context of sex and drugs, like, you have to maybe make some sacrifices. And I think to give people, again, I think useful and realistic advice, like, yeah, girl, like, you could do this when this was going on, and yeah, you're home more, but you know, maybe it's better to maybe cut back. Again, sex workers, people who chop, who deal, whatever. So we have to kind of maybe look at all those things together, you know what I'm saying, before we just talk about just sex and drugs and hooking up. Yes, I understand that's a part of the conversation, but like there's other dynamics, and I don't think people are really thinking about, but yeah, that's what I wanted to share.
I like this idea of thinking about like if I, you know, the goal is pick none. If I can't pick none, pick one. If I can't pick one, pick some. And just to reiterate like what Caleb and Ali said earlier too about like these conversations are really like this is a thing that we know from like our histories as queer men navigating like sexual health, you know, like this is a thing that we know, like this is a part of our lives, is trying to take the information that we have and make the best decision that's going to, you know, kind of fit with our own values. And one of the things that we're seeing is like, yeah, this is a pretty, like, this is a big deal, you know, like this is a pandemic that's like changing the world and changing our lives. And we also need to find ways of functioning in it. So while this is not like the goal of this is not to give permission, it's to just acknowledge the realities of people's lives and say, okay, so if I can't do this, then I don't want to just say like, okay, well then, like throw it all away, like I still want to be able to kind of look out for myself as best I can, look out for my community as best I can,
When we talk about substance use and HIV, we found out that undetectable equals untransmittable, and we learned to work within that scope. We learned about sharing equipment and how we can actually share safer and things like that. So when I say what is our responsibility in this COVID situation, I'm certainly not saying that we shouldn't be having sex, and I hope that people aren't getting that message from me. What I'm saying is, how can we kind of relate COVID to the work that we've already been doing for HIV and other STVBIs, knowing that COVID is much more transmittable than anything we've ever really dealt with before as a gay community. When we look at HIV, back in when it was a crisis, we certainly don't want that reaction of like, I'm going to leave you to die because I don't want to touch you because you're disgusting. And we don't want to create that kind of fear around COVID-19, but we certainly also want to be, caring. And I think it's really important too, when we talk about the messaging of COVID-19, there are people living with COVID-19 and we don't want to stigmatize those people either. So, we want to make sure that we're being respectful to everybody while still at the same time protecting ourselves and our community. So my question is, what have we been able to do as a community, as workers, as researchers, things like that, to say, okay, we have this virus, we have gay men who are going to do these behaviors. How do we protect these gay men while they're doing these behaviors from this virus? And I guess that's the question I'm trying to get to.
Honestly, when I'm dealing with this this situation with a very close friend, because girl, your habits are actually going to affect me, because if I'm going to be limiting my interaction and you are out there, I don't want to control your life, but at the same time, again, you have to be real. This is not like, again, HIV that is sexually transmitted. We know how HIV is transmitted. I'm talking about what we know now for COVID-19. You have to limit your social interaction, then you have to not sugarcoat these things. Yeah, I don't want to hurt anybody's feelings, but like, I'm going to have that conversation literally with that friend today. And like, okay, girl, if you're going to not listen to me, you're going to put me at risk. And also you're going to cause me possibly get infected. And also I'm here by myself in Canada. In my country, they're on curfew at 9 p.m. Other places are handling it way, way differently than we were doing. I think in Toronto, where we have the privilege to choose to be out and hooking up, is amazing. But no, you have to keep it real. Like I said, the working girls are like, most of them I know, they're stopping. This is how they make their way of living. And they're like cutting off like a lot of things they do. You have to make certain sacrifices. And, for one of them, it's like not sugarcoating shit. Yeah, you don't want to hurt people's feelings, but at the end of the day, like, girl, this is a serious thing. And I'm not, again, no judgments, whatever. Like, again, I've been using my own strategies, like hooking up with maybe not one person or whatever. But again, I know we all have different options and stuff, but we have to be like honestly realistic.
I mean, personally, I'm getting a lot of emails or calls from clients asking if I'm self-isolating, and if I am, if they can hire me. So this is a very like difficult place to put a sex worker in, right? Because if they need the money, then that's a very difficult question to answer, honestly. So, I mean, I guess what I'm asking is, again, my same point as before, is try to be honest. It's not always easy, but, if it makes a difference between a paycheck or no paycheck, then I still think morally you want to be as honest as you can.
Now, if you're self-isolating, and then if you are, then they want to hire you, but self-isolating from everyone else except for that one client, I guess is the assumption.
Right. It's like a really silly way to approach an escort, but people like doing it, right? Yeah.
It's like, how much are you paying, homie? Because that's what it'll cost you to be exclusive. So anyway.
There's some really, really good questions and conversations that have kind of come up from this already. And Oran was talking about like how to like just be aware of the the fact that the dealers are like in community and doing the service for folks. And you know, like,
I think trusting your drug dealer is kind of important, and also like if you're getting drugs from someone who is not comfortable talking to you about the drugs that they're giving you, and that like, is not very knowledgeable about what's going on, then you should be a little suspicious of that. Like anytime someone's not willing to give you information that you need, that should be a little concerning. I think like if your drug dealer is an asshole and you don't like him, then you should definitely find one that you do like, because that person should care about whether or not you live or die. And yeah, so I think that's important.
I just want to take like a sec to pick up on what you were saying, Oran, as well. And I think this all is about showing care to each other and honesty and communication, like all those things that, you know, like keep coming up for us. But I think like there's also things you can do just with your interaction with a dealer, or also with other people who either you might be partying with or who might be helping you out to get you something or whatever. Like sanitize these bags. You know what I mean? Like if you have some hand sanitizer or some alcohol, the thing is like as soon as you open that baggie and your fingers, like you're the person handling it, ideally. And again, I would also emphasize handle your own kit and handle your own drugs, make your own hit. Because right now we just don't know we never know where people's fingers have been. This is always good advice, but let's just more than ever remember to always use brand new, fresh equipment, but also sanitize before you open that baggie. Do it, and just keep it clean as much as you can. There are, at least I'm based in Toronto, and there are still harm reduction kit distro sites that are open, as well as safe consumption sites. So it's changing every day exactly which ones are. But if you go to the Toronto Harm Reduction Alliance website, they are updating their blog every day with a list of hours, what they have, where they are, and what their protocol is. So that's amazing. And I don't know if there are other, if like similar sort of drug user groups and stuff are keeping that information in your city, but it's worth trying to connect with harm reduction folks if you're not sure where to get a new pipe, some new syringes, like new rigs and kits. Because, so I just think that's one thing I want to add is like that's a place where that hand washing and sanitizing really comes in. Yeah, and especially like if you're jonesing for it because you're using less right now, or you're you finally got it, it can be easy to forget those things. So let's just try to, you know, keep that in mind. Yeah. Yeah. Eric.
I like the idea of purchasing more supply in advance. I think that if that is something that you're doing, I would recommend as well to pre-package your dosage, because when you're high and you have more drugs, we might not dose properly. Like we might not be able to do that when we're high. So for myself, I always did that in advance. Like for example, if I had a bottle of G, like a water bottle full of G, I would put it into small vials so that when I'm pouring it into a glass, it's not 6 vials of G by accident when I really wanted to put just 1 vial in. So
yeah, and I think like that brings up the thing about using alone that you mentioned earlier, and I'm really glad you did. And I want to just come back to that to emphasize that, like especially with G, like everyone knows about G'ing out. And so it depends on where you are, if you're at home, and what G'ing out looks like for you. But keep that in mind, like keeping that in mind to have doses pre-measured, to really be careful about your limit, to set timers and stuff to make sure that you aren't G'ing out if you're not intending to. And also, it can be awkward to text a friend, or I don't know, someone was telling me like, just put on your Instagram story, like, who's willing to help me out with something weird right now? Which is not weird, but like there are ways to couch it and be cute, to be like, I need to tell you that I'm going to use these drugs, and please check on me in 3 hours. There's also the Ontario overdose prevention line, which you can call while you're using, and you can call, they'll stay on the line with you, non-judgmental, and you can have a conversation with them about emergency services.
Can I say one more thing? I thought it was something I really wanted to say.
Okay, you have 1 minute.
Okay, I just really want to say we also have to know that we have to really protect our healthcare workers, because they're the ones that are going to be getting this a lot. So it's like, protect your healthcare workers. This also shows how important healthcare is. We need public healthcare. It should be free and accessible for everybody. Yeah, I'm done. Okay, protect our healthcare workers. They're the ones that are getting sick.
sometimes, because we are a little bit more paranoid as a community, if you are someone that is still cruising and you're still having those conversations around informed consent and sexual, you're negotiating sex, I think it's really important to make yourself available for more questions. So if someone's asking, one thing that I think annoys a lot of guys is when the guy just asks 1,000 questions and never actually comes over, and you're like, just come over already, I've answered all your questions. Maybe be a little bit more just available to answer more questions. Understand that people are a little bit more nervous than just, hey, I don't know if I'm going to like the sex I'm going to have when I get there. It's bigger than that now. It's more like, I want to make sure that I'm going to be safe leaving my house and then coming to you. So be nice to people online. That guy that's asking you 1,001 questions before he shows up to your house, it's not necessarily because he's a flake. It could be because he has anxiety, or they have anxiety. You know what I mean? Like, I think that's really important as well. I think it's important to not hide your symptoms. So if you have had a scratchy throat, or you have had a lot of phlegm in your respiratory system, don't just assume that it's because you've been partying for 4 days and be like, oh no, I'm good. I know I'm good. I've just been partying a lot. Well, you don't know you're good unless you get tested. So if somebody asks that question, like, hey, are you experiencing any symptoms? And you are, don't just shrug that off because you're horny and be like, oh no, I'm fine. And sometimes we get, especially, and I'm guilty of this myself, I see a really hot guy, I really want to hook up with this guy, I might omit some information so that I can go over and see him and then hopefully tell him in person and be like, by the way, I left this out, but this is not a time to do that in person. Like, have those conversations with people online and let people know right off the hop what you're experiencing and how you're feeling before you get there.
Just this echo of care and good, again, is like, it's the antidote to the shitty squirt conversations I keep seeing.
I guess along the line of what you were saying about being okay with it, being asked more questions or whatever. Also, just asking people questions, like, asking if people have been traveling, if you're going to hook up with them, or if they have any symptoms, right? Those are both really smart things to be asking right now, and trying to avoid, contact with people that have been traveling or do have symptoms. Other than that, I think it's good to call your friends, check in on people that you haven't seen and that you haven't been talking to, and check in with everybody and make sure that everyone's still okay, and that everyone's still, maybe if they are sick, maybe you can bring them some groceries and leave them at the door. Maybe there's ways to be there for each other without actually, sharing space or being close to each other.
Cool. Oh, sorry. I just think it's incredibly important to remember that, we as queer people have been, like Kiki said this once before, and I was like, it's so fucking real. It's like, we have been taking care of each other for a long time, and we will continue to take care of each other as long as we center truth and honesty, with one another, and love for one another in the center of it. We can do this. It's not this scary. We've done this before. And as a matter of fact, I'm going to go do someone right now. So I'll see you guys later.
Also love to talk, obviously, but I just looked at the time and we're a little bit over. So I don't know if there's stuff, Kiki, that we didn't touch on that we should, or maybe we can each just do one closing thought or something and say what we're going to do with the rest of this evening or whatever. I don't know, or don't.
Thanks for hosting this. Definitely I learned some, and it's good to get my word out there, but stay safe, everybody, and stay there for your friends and be there for each other.
I'm so thankful for everybody that came to participate in this. I'm really excited to get to be answering some questions and hear from folks IRL while this is being played out. With that in mind, I think it's great to also just acknowledge that queer men are really amazing at kind of finding our own ways of navigating really complex and really emotionally charged situations that relate to our sexual health and our health in general. And I'm really thankful that we were able to have this kind of a conversation in a really frank and generous way with each other. I'm really glad that we got some differences of opinion as well. And yeah, I just think we're muddling our way through, but the way that we do this the best, and the way that queer guys have been doing it forever, is get up-to-date and accurate information, share it with the people we care about, and then we make the decisions that best work for us.
Big shout out to GMSH. if you want to know more, like definitely if you're on Instagram or on Facebook, like look in the different places for where those links are. You can also shoot a message to GMS8 if you want to connect about some of this stuff. There's a group of us that have a Facebook group called Info PNP, that's just for guys who party, and is like super cute. And there's like, yeah, you can connect with any of us. But I just want to say a big thanks to Caleb, to Ali, to Oran, to Eric, to my good sis Makiki, and to the GMSH, and to my cute self. Oh, no touching the face. My cute self. This has been really awesome. So thanks.
And just a closing word for folks that if they want more information about COVID-19 and how it's kind of affecting your community and the most up-to-date and accurate information that's specific to your geographic region, is contact your own local health authority. They are going to be the ones that know what's going on in your area, and actually geographic specificity matters right now.
Yeah. All right, so with that, we're done, right?
Thanks, everybody.